Hey everyone, welcome back to Shaz's Tech Hub. Today we're going to talk about virtual reality and whether it can help end loneliness. It's an interesting topic. I know VR has been really hyped up over the last few years. Is it delivering? That's a whole other type of conversation. Today we're going to focus on the Wall Street Journal and what they posted about virtual reality in the context of healthcare. So we'll kind of put up a little text here for you guys to see, and then we'll discuss whether VR can really help those who need assisted living and whether that's a doable thing for the future. Now, researchers say it isn't clear yet why the technology works so well at helping seniors, but over the past 3 years, a handful of studies have shown that technology's positive effects on the emotional health of older adults. For instance, one field study done in 2018 by a team of MIT found that almost 39% of a group assisted living residents reported better perceived overall health while after watching VR images related to travel and relaxation. For another group who watched the same image on TV, the figure was only about 14%, according to Shei-Wu Lee, one of the paper's co-authors. The results were even more impressive when it came to perceived emotional well-being. Almost 30% for VR group reported an improvement compared to 4.8% of the TV participants. Dr. Lee says a total of 63 assisted living residents with a median age of 88 took part in the study. But these are real results. This is a doctor, not some VR expert startup that's trying to sell you something. These are experts that are showing us that VR, not TVs, are having a real impact on these folks' lives. That's pretty big. This is something serious, right? Imagine if a pill was able to produce these results. I can assure you that pill would be all over the ads, especially in the US. We all know how many medical ads we get on the TV. Ironically, we may get ads on VR about the medicine, but this isn't medicine, at least scientifically speaking. This is virtual reality. I find this really fascinating. I did not think that these results. I mean, I know degree in economics. I understand sample sizes. It's not a very large sample size. Culture, language, what's the average income of these folks? How really fancy is this establishment? A lot of questions, a lot of ways we can poke holes at the study. I understand, but for now, this seems to be something serious. I mean, there's so many different companies out there that are producing VR. The costs should be able to go down. I'm pretty excited about this. Just a reminder, leave your thoughts in the comments down below. Smash that like button and hit subscribe. But I'm really excited here about this technology. So let me know if I'm wrong. Let me know other things I'm not considering about this study and about the context. The digital divide is really real as well. Some real issues to think about. But there's some hope. I think there's some hope here. So thanks again for joining in on Shaz's Tech Hub, where we talk about all things video game industry insights and some technology insights and some policy. It's my early days being a YouTuber, so forgive the audio quality, forgive the video quality, forgive the editing. This is rough and raw. I mean, I got my TV here. Stay tuned for a review on the Samsung Neo QLED here, either posted before this video or after, but excited to get this going, get this motion going. I plan to do another 52, 55-ish videos. I'll explain why that particular number in the next video. So what do you think? Virtual reality, fad, not fad, that's a different topic. What do you think about VR in healthcare? Do you see your grandparents being able to use VR? Do you think people will be able to feel a bit less lonely? And what are your thoughts on the research papers being done right now about this? Hey, think about it in the future. Maybe we'll be the ones using virtual reality when we're 120, hopefully, in the future to see how we can, recover faster from our elements. So leave a comment down below and smash that like button and subscribe, and let's figure this out together. Virtual reality, healthcare. Is it a good thing?